Hey guys, how's it going? I just want to say thank you for those who responded to my video. You guys had some pretty interesting, pretty cool comments to say, so I kind of wanted to go over a few of them. I'll start off with Lizzie's comments. So she talked a little bit about kind of what Dr. Hogan taught us way back in the day with the subjective visual vertical testing. And this patient had that leftward tilt. So basically Lizzie just was asking if it had to do anything with the horizontal canal or if it was a utricle issue. And it's definitely more of a utricle issue. Again, there's not too much data to say that this is a strong test to base most of your hypothesis off of. However, it is helpful if other pieces of data are pointing towards that deficit. I do like what you were saying, talking about the first episode of dizziness when she was working out. You said it's possible that some sort of vascular change and a drop of oxygen leading to that kind of scary effect that she was feeling, and I thought that was actually a very possible scenario that happened. So obviously I can't go back and say whether or not it was, but it's what I was thinking. And then you were also talking about the DHI, how we score them and how we track them. We don't do inventories for each specific question and like how it's separated through social and things like that. We mainly just track the number, however you have access to the DHI itself. So if you would like to go back and do that, you could do that as well. And that is something that's actually might be very beneficial for her, so thank you for that. I might even take a look at the individual questions and see what she's scoring there. Let's see, Santi. So pretty interesting things that Santi brought up. He brought up the question of triple PD, and good job, because that's what we initially diagnosed her with, was that triple PD. As time moved forward, once that objective testing started becoming more normal, we started saying, hey, well, maybe it's past triple PD, maybe it's something else. And you said something about her being pretty young. We have a good amount of young patients at our clinic too. Yes, most of them are geriatric, but we see a lot of young people for similar situations and also head injuries and things like that. Let's see, what else did you ask? It has been more than 3 months. It's been quite some time that she's been dealing with this, so that kind of leads us into Carmen's. Let's see. So Carmen hit it right on the nail. She said Debarquement syndrome. Like I said, we initially thought triple PD, which is typically what most people go to now for situations like this. However, once those objective testing started becoming more normal, and we actually just did a reassessment yesterday where everything was beautiful, everything was perfect, however, symptoms are still present. Carmen then goes and she kind of talks a little bit about different types of treatment that are possible for Debarquement syndrome. We have been adjusting her therapy a lot, targeting, instead of triple PD, targeting more towards that MDDS situation. Carmen also brought in the idea of mental health and what anti-anxiety medication might do for a patient such as this. She currently isn't on any. She does see a licensed therapist. The last time I talked with her was actually yesterday, and that's when I started to bring this up. Again, we've talked about it before, but I wanted to go back to it. Essentially, she's seeing a therapist. She doesn't do cognitive behavioral therapy for the mild debarquement yet, so it's something I highly encourage her to do. She states that her anxiety is not present, so kind of makes counseling a little bit harder, because she says that she doesn't have anxiety. However, she doesn't go to social situations because of her symptoms. She, like for example, Easter, her family had an event and she didn't go because she was worried that the symptoms would be present. So, with this case, it's kind of hard because it's a lot of counseling, and it's kind of walking that border of what is in our scope of practice and what is not. What can I talk about this patient and what can't I say? Because I don't want to say anything that's not within our scope of practice, and it's not my specialty, it's not my field. So I'm going to save that conversation and information for someone who knows better than I. But yeah, thank you guys so much for your questions. And I miss you guys. I hope to see you at graduation. Have a good one.